Hello, everyone. Good evening. So happy Thursday. We are here again, as usual. I would always say that for our Facebook Live on prioritization and delegation. So thank you very much for being here, everybody. And again, it's Thursday. Okay. And I was flashing the names of students, giving a shout out to the early students who are joining our um, session for tonight. So I already gave a shout out to everyone. But anyway, thank you very much, everybody, for being here. So we have prepared again, as usual, questions for you tonight to practice on prioritization and delegation. Okay, so we never run out of questions, everyone. Do we have any updates regarding the NCLEX? Nothing so far. Just remember again that October 1 will take effect. Some changes to the modified examination. Okay, so again, you have 75 questions as your minimum for the NCLEX PN and the NCLEX RN, and also you have 145 as your maximum number of questions. Okay, and it will take you 5 hours maximum, maximum for the examination, everybody. Okay, so thank you very much, everyone. We have here Gian. So Gian said that she got my book. Thank you very much. Okay, so I hope that you like my book. All right. And then we also have Nadia. You're actually in the live right now. Okay. So also we have so Atiet Pascual. I think she was our previous winner also for the 90-day free online NCLEX review. Okay, so for tonight, everybody, let's start off, with introducing myself first before I forget. So my name is Mr. Alan Matus. I am a nurse educator, and I have been teaching students for, I think, almost 25 years. Okay, teaching nursing students how to pass the NCLEX examination. I'm also the author of a book that I published in Amazon that is a simple, fast, and easy NCLEX review. And then also I'm the president and the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. At this time, I'm working as also as the nursing faculty of a nursing college, helping students pass their NCLEX examination and pass a nursing program also. Okay, so without further ado, let's have our first slide for tonight. So we always start off with our motivational photo of the week. Okay, so this photo was sent to us by Marilu, and she is in Las Vegas. And while reviewing in Las Vegas, or while staying there rather, she sent me a photo of her workbook while studying, and of course you can see in the background, I'm not really very sure which hotel is that. Is that the Mandalay Bay Hotel? I don't know, but it's really very hot in Las Vegas, and she sent us a picture. So that's what you call dedication and determination to pass your NCLEX examination. Okay, so thank you very much, Marilu, for sending us this picture. Okay, and then of course another one, we have a testimonial from a student who passed the NCLEX examination. We forgot to post this the last time. So Jay actually passed the NCLEX examination, and she gave us a very good recommendation in Facebook. Big thanks to Matus Nursing Review for helping me pass my NCLEX PN. I graduated in 2008 in the Philippines, took my NCLEX last August 10 with 130 questions, and successfully passed. As a repeat test taker, I came across Matus Nursing Review as my last resource and watch all of the videos. I cannot thank enough Matus Nursing Review in preparing me to tackle nursing prioritization and delegation. Matus Nursing Review helped me boost my confidence in taking the NCLEX. For those of you who failed so many times and needs a boost, I recommend Matus Nursing Review in preparation for your boards. Never give up until you reach success. I've tried all those NCLEX preparation out there, but didn't work for me. Only Matus Nursing Review, trust me. This feeling is beyond happiness. Prayers, preparation with Matus Nursing Review is the key ingredient to passing the NCLEX. Thanks for all you do, Sir Alan. I appreciate you. So this is a very heartwarming testimonial. I just saw it this morning as well. And well, thank you very much for achieving your dream. And I promise that we will work hard to provide you the best program in order to pass your licensure examination. Okay, so congratulations again, Jay. All right, so yes, so everybody, okay, so Atet said that nice motivational peak, I need that. Yes, so I always show that every week. So for those of you who has my workbook, send us your picture or your photo so that we can show that every week during our Facebook Live over here. Okay. Now, without further ado, I'm gonna go straight directly into the question. Okay. But however, at the end of the program, as usual, we will be announcing the winner of our free 90-day online NCLEX review. And for tonight, we don't have a contest. Okay. So we don't have a contest. So maybe next week, just watch out in the advertisement. All right. However, we're going to have a winner for last week's session. So we're going to announce that. All right. So let's have the first question, everybody. And I hope that you are all excited for the first question. Okay. So our first question is going to be on prioritization, everybody. Okay. All right. So for this prioritization question, everyone, the first question is, the nurse is caring for several senior residents in the skilled nursing facility. Which of the following clients requires the most immediate attention? A, the 71-year-old with diabetes mellitus who has polyuria and a blood sugar of 160 milligrams per deciliter. B, the 58-year-old client with dementia who has been restless and recently reports seeing crawling insects. C, the 74-year-old client with left-sided heart failure who complains of dyspnea when lying flat. Or D, the 65-year-old client with iron deficiency anemia who appears pale and reports dizziness and feeling cold. So this is your first question, everyone. And also I would like to thank some students. I actually have several students who emailed me and contacted me on how to join this program because it was posted by someone in their timeline. So thank you very much for spreading the news and having your friends also know about our session. Okay, so again, you have here which client requires the most immediate attention. So which patient here or client is the most unstable that you need to deal with first. And can you give us a little bit of rationale again? What is the reason why you pick your answer? Why is it A? Was it B? Why is it C? D? Okay. So what do you think is the best answer to this question? Again, when analyzing this question, everyone, I want to make sure, okay, that that strategy that you need to use is if it's part of the disease process, if it is expected, if it is chronic, it is not life-threatening, so it is not a priority. If you have two unstable situations or two patients who are or two clients who are unstable, you always have to rank who comes first. All right. So use your strategy, which is the airway, the breathing, and the circulation, and then the neuro, and also safety, risk for infection. And when you answer this question, you always have to think what is going on with this patient, what emergency or life-threatening situation is present in this patient. Okay, so let's dissect the question. Most of you have already given your answer, everybody. Okay, so some of you, okay, all right, so let's have your A, B, C, or D. Okay, so this is really a challenging question for everybody. Okay, all right. So what do you think is the answer to this question, everyone? I know that most of you answered, we have different answers in this question, everybody. Okay, so the answer for this question, everybody, is going to be, all right, so I can see a lot of questions. So what? Okay, so you have to do your prioritization here. Okay. All right, so the answer is going to be letter what? So most of you got the correct answer, actually. Okay, so the answer to this question, everyone, is going to be letter B. So letter B is the answer, everyone. Why is letter B the answer? Okay, now letter B is the answer because, okay, so letter B is a dementia patient and who has been restless. So the key word that you have there is this patient is restless, okay, and recently reports seeing crawling insects. Now, the fact that you see the word recently, sudden, acute, new. That means that it is something that is different and may indicate something is going on with your patient. Did you get that, everyone? Letter B actually may be an indication of the occurrence of delirium. Delirium, everyone. So delirium. I'm not sure if all of you have, or some of you have heard about delirium. How is delirium different from dementia? Now, we really need to make sure that you understand what delirium is, because that is a common in service that I used to do when I work in a hospital. I have to train nurses on how to assess patients for delirium, because sometimes what happens with dementia is that we presume that their symptoms are always related to dementia. However, when you look at letter B, this is a patient who's restless, which is a sign of delirium, one of them. And then the keyword is recently reports. When you see recently, new, sudden, acute, seeing crawling insects, that is visual hallucination. Dementia patients have hallucination. However, the word is recently reports. Okay, so you want to find out what's going on with the patient. Is delirium happening? Maybe no, but then we have to find out what's going on. Why is letter A not the answer? Because that is a diabetes patient and we expect somehow the blood sugar is abnormal. That's okay. 160 milligrams per deciliter. There is nothing that indicates that this patient has a complication going on. Okay, so 160 is not really are missing some phrases or words that will make it unstable. Now let us see a 74-year-old client with left-sided heart failure who complains of dyspnea when lying flat. Remember that patients with left-sided heart failure has pulmonary edema. Remember that they have pulmonary edema and or pulmonary congestion, and it's common for them to complain that when they're lying flat they cannot breathe. But does that indicate an emergency in this patient? If this patient for letter C is having pink frothy sputum, restlessness, okay, restlessness, anxiety, okay, a pulse oximeter reading that is going down, then maybe what's going on is severe or acute pulmonary edema, okay, which is considered to be an emergency. But then just having a left-sided heart failure with orthopnea, you call that orthopnea, right? When the patient is unable to breathe when lying flat, the patient needs to sit up. And all heart patients, heart failure patients are like that, heart failure patients, especially left-sided heart failure, they cannot tolerate being flat when in bed. Okay, so that's why letter C is not the answer, unless again I will add something there like pink frothy sputum, restlessness, anxiety, low levels of oxygenation. Okay, then C could be a priority because it is an airway issue. But letter C, that's part of the manifestation of your patient. Okay, now letter D, the 65-year-old client with iron deficiency anemia. And again, when someone has anemia, it is expected the person will appear pale, reports dizziness, and feeling cold. Okay, so D is part of the manifestation of your patient. Am I right? So letter D may be a concern, however, is not as urgent as your letter B. Okay, unless in letter D we will say the patient is pale, reports dizziness and feeling cold. But if I add the patient becomes confused now, then that's a different story. The patient has a change in the level of consciousness, the patient has shortness of breath, then D becomes a priority. Did you get me, everybody? So D is part of the manifestation. We don't see any clinical description that tells you that letter D is unstable. Am I right? So letter D, this patient is diagnosed as having iron deficiency anemia. Oxygenation, but you have to look at letter B. Letter B, someone who is restless and someone with visual hallucinations, then you have to address that first, okay? So I know that you're thinking of airway, breathing, and circulation, but we're not talking here of an unstable patient in some of those choices, all right? So the answer is going to be letter D. Letter B, actually, everyone. Okay, so let's go now to the next question, everyone. So we will have the next question is going to be again prioritization, everybody. Okay, so this is the next question. All right, So our next question, everyone, is the nurse cares for several clients in the psychiatric unit. Which client should be seen first? A. The 31-year-old client with major depression who missed eating breakfast and group activities. B. The 52-year-old client with bipolar disorder who is talkative and easily distracted. C. The 62-year-old client on alcohol withdrawal who reports severe sweating, hallucinations, and palpitations. Or D. The 35-year-old client on heroin withdrawal who complains of body aches, fatigue, and nausea. Okay? So again, the nurse cares for several clients in the psychiatric unit. Which client should be seen first? A. The 31-year-old client with major depression who missed eating breakfast and group activities. B. The 52-year-old client with bipolar disorder who is talkative and easily distracted. C. The 62-year-old client on alcohol withdrawal who reports severe sweating, hallucinations, and also palpitations. Or letter D, the 35-year-old client on heroin withdrawal who complains of body aches, fatigue, and also nausea. Okay, so what's the answer to this question, everyone? Okay, and can you please put your rationale why you answered letter A, letter B, and letter C, and letter D as well? I would like to find out what's the reason why you answer those items, everyone. Okay, A, B, C, or D. So it seems like most of you already has given your answer. Can someone, okay, give me a reason? When you look at the signs and symptoms, I told you that the NCLEX will not give you the diagnosis. You have to figure out what's going on with this patient, right? So you always have a rationale. Why is it that you chose letter A, letter B, letter C, or letter D? So I would like to find out what did you see in that situation. Okay, so let's proceed, everybody. Okay, let's proceed. All right, so let's proceed, everybody. So okay, so some of you are saying palpitations could be the reason. So let's dissect this question, everyone. Okay, what's going in this situation? Okay, so the strategy here is that you need to know your psychiatric emergencies. Okay, what happens when you have major depression? Is there any indication of suicide there? Is that the priority, your letter A? Letter B, when you have a manic patient, is that a priority? Should you really see that patient first? Letter C, okay, you have a patient who's having severe sweating, hallucinations, and palpitations. And letter D, that would be your body aches, fatigue, and nausea for heroin withdrawal. Okay, so the answer for this question, everyone, is going to be letter C. Very good, everyone. So C is the answer. And I think someone gave us a very good rationale, okay, or reason why letter C is the answer. Because letter C indicates the presence of delirium tremens, okay? Now remember that you have different stages in alcohol withdrawal. You have stage 1, stage 2, and then stage 3. The worst and most life-threatening stage of alcohol withdrawal is your delirium tremens, which is characterized by severe sweating, by hallucinations, and then also by palpitations, fever, unstable vital signs, and lastly, seizures or convulsions as well. So that's why your letter C is a priority, because once the person or the client reaches the stage of delirium tremens, that is an emergency, we need to do something about it immediately. All right. Although definitely when you have an alcohol withdrawal patient, we take care of the patient at the beginning, at the stage 1, stage 2, and monitor the patient if ever the patient progresses into stage 3, which is your delirium tremens. And we really need to intervene with delirium tremens because that is an emergency stage. Okay. Now, letter A, somebody who's depressed and missed eating breakfast and group activities, we don't see any indication of acute suicidal ideation. There is no plan, there is no statement that the patient is going to commit suicide. Letter B, the 52-year-old client with bipolar disorder, talkative and easily distracted. Those are part of the manifestations, and there's no indication that this patient is a danger to himself or a danger to others as well. Now, letter D, the 35-year-old client with heroin or opiate withdrawal. Always remember that The initial stages of opiate withdrawal will be having patient will be having body aches, fatigue, nausea, diarrhea, uh, muscle weakness, body malaise. Those are the characteristics on the initial stage of opiate withdrawal. Okay, so that's why the answer for number for this number or for this question is going to be letter C. And again, I tell you, A, B, and D are not the priorities. It's going to be letter C. However, everything can change in this question. If we add something to A, if we add something to B, if we add something to D, then this situation can change. All right. So especially when you have new symptoms or complications that are added to the situation, they may become priorities as well. But for this situation, the one that is having a complication is going to be letter C. So that is going to be a safety issue. All right, safety issue, letter C. Thank you very much, guys. So I hope that you got that answer correct. Okay. So yes, so Ms. Kaur said that this patient is having hallucination. Well, in stage 2 of alcohol withdrawal, you have vital signs that are stable and then also hallucinations. However, hallucinations combined with fever, combined with diaphoresis, combined with unstable vital signs, that would be a prelude to delirium tremens, especially the danger which is convulsions or seizures in your patient. Okay, the initial signs of alcohol withdrawal will be tremors and anxiety, and that's why we give sedatives to your patient, and then monitor them really to make sure that we assess if they progress into stage 3, which is your delirium tremens. And question everybody, I have a question. If you know a patient is alcoholic and then is admitted to the unit, what is the question that you will ask this patient? If you know this patient has been an alcoholic for 20 years, what is the most important question to ask the patient? Can someone tell me in the comment section? What is the most important question to ask this patient? Okay. All right. So the question that you're going to ask definitely is what? The question is you ask the patient, when was the last time that you had a drink? Okay. Because if this patient suddenly stopped drinking within 8 hours or within a few hours, this patient will start showing signs of withdrawal symptoms, and we need to monitor and manage the symptoms. All right. Okay. So when was the last time you had a drink? Very good, everybody. Okay. So at this time, we're going to have your delegation question now, everybody. So thank you very much. You are also engaged in the comment section. Thank you, guys, for. So I hope you learned something for tonight again. All right. So let's have your delegation question, everybody. Okay. All right. So this is your delegation question for tonight. Okay. So the registered nurse works with the unlicensed assisted personnel or UAP in home health care. Which task is most appropriate to delegate to the UAP? Select all that apply. A, removing the PICC line dressing. B, elevating the leg of the client with varicose veins. C, assisting the client on how to arrange medications in the pill box. D, putting the client in the chair during daytime. Or E, discussing the purpose of advanced directives. So you have select all that apply options here. You have to choose which task is most appropriate to delegate to the UAP. Okay, so A, B, C, D, or E. So again, remember, it has to be within the scope of practice of the UAP. It has to be within the scope of practice, a stable patient, and also a simple routine only. No complex thinking that requires assessment of a licensed nurse. Okay, so again, okay, what's the answer to this question, everyone? For your UAP, what can we delegate to the UAP? All right. A, removing the PICC line dressing. Okay. B, elevating the leg of the client with varicose veins. C, assisting the client on how to arrange medications in the pill box. Okay. Letter D, putting the client in the chair during daytime. And letter E, discussing the purpose of advanced directives. Okay. All right. So which one can you delegate to the UAP, everyone? Always remember, do not delegate anything that is that involves any safety. Okay. Anything that is not part of the training of the UAP. All right. Okay. So the answer is going to be letter what? Okay. Always remember, RNs cannot delegate it. No evaluation, no assessment, no teaching, no planning. So remember that. Okay? So remember that. Okay? So the answer is going to be, all right. So the answer to this question, everyone, is going to be letter B and letter D only. Okay, letter B and D only. Now, removing the peak line dressing is the responsibility of the RN, of course. Okay, that's going to be the RN. Elevating the leg of the client, of course, that could be for the UAP. All right, so B and D are within the scope of practice of the UAP. A is an RN, okay, RN responsibility because as a central line. Your letter C, assisting the client, okay, on how to arrange medications, especially when you say the word, although the word says it's not teaching, but then you have to remember it says on how to arrange medications. Okay, arranging medications in the pill box, is that going to be something of a responsibility of the UAP? No, you're arranging medication. It's not just putting medications, but you're arranging. So who's supposed to be the one doing that? Assisting the patient. And we're talking of medications. And we all know that medication error is very common among especially patients or the elderly. So it has to be the responsibility of the licensed nurse. We're talking about medications there. What if the patient took the wrong dose of medication or put the medication in the wrong spot, for example? Am I right? So assisting the client, then definitely that would be the RN. Okay. Now, letter E, discussing the purpose of the advanced directive, and of course, discussing teaching, of course, that's complex. Just always remember, guys, your key here is not to get stuck with the words, but you have to think of the task. Is it complex or not complex? Is it complex or not complex? Okay. If a mistake happens, is it going to endanger patient safety? Okay. It has to be a simple routine. Okay. So that would be the answer is going to be B and D. Okay. All right. So assisting the client on how to arrange medication. The keyword you have to look there, guys, is especially arrange medications in the pill box, everybody. So always remember in the NCLEX, you don't have a fixed answer. Okay. In the NCLEX, every situation is different. You know, when you go out there and practice nursing, nobody will tell you when this happens, it's A. When this happens, it's B. No, it's not like that. In the NCLEX, there's a lot of factors that will make you think how critical is this condition. Should I delegate or not? So that's why we use critical thinking or critical judgment. Okay, so there's no fixed formula for all of the situations sometimes. All right, so always remember that, guys. So I hope that you learned something out of this delegation question. Okay, so the answer is going to be B and I think that was B and D, right? So I really forgot the answer as well. Okay, but anyway, so that's it, everyone. Now let's go. So that was an exciting question, right? So always remember, if it's complex and you're dealing with medications there, so of course that would be, that would be for the licensed nurse, of course. Okay. Now let's go to, all right, let's go to another question, everyone. So this is going to be delegation again. So the registered nurse delegates tasks to the licensed practical nurse in caring for a client with advanced dementia. Okay, which of the following tasks may be delegated to the LPN? Okay, which of the following tasks may be delegated to the LPN? A, assessing for the presence of new onset delirium. B, implementing fall precaution interventions. C, explaining the purpose of medication use to the family. D, administering haloperidol or Haldol for severe agitation. Letter E, completing the fall prevention care plan. Okay, so the RN delegates tasks to the licensed practical nurse in caring for a client with advanced dementia. Which of the following tasks may be delegated to the LPN? A, assessing for the presence of new onset delirium. B, implementing fall precaution interventions. C, explaining the purpose of medication use to the family. D, administering haloperidol or Haldol for severe agitation. Or letter E, completing the fall prevention care plan. So you have A, B, C, and D and E. Okay, so what do you think is the answer, everyone? Okay, what's the answer to this question? Okay, all right. So we have a patient who has advanced dementia, everybody. And I hope the NCLEX is going to be like this, very direct to the point, and everybody's getting the right answer probably, right? Okay. So everybody's giving all of their answers. So we have, okay. So we have different people giving us their answer. Renally said, okay, she said B and D. Okay, we have Rowan is also okay, the same thing. Okay, all right, very good. So let's proceed, everyone. Okay, so the answer to this question. All right, so let's see. The answer to this question, everyone, is going to be okay. Some people are still giving their answers, but anyway, the answer, everyone, is going to be okay, very good. So you got it right, everybody. The answer is going to be B and D. Correct. Yes, because you cannot delegate, or the RN cannot delegate TAPE. TAPE means teaching, assessment, planning, and evaluation. So when you say letter A or letter B, let's go to the correct answer first. Okay. So for the correct answer, everyone, B is included as a scope of practice of LVNs or LPNs. LPNs, when it comes to the care plan, LPNs help implement the care plan. Of course, right? So whatever is in the care plan, if the care plan says that fall precaution intervention is bed in low position, removing clutters from the floor, okay, providing adequate lighting, for example. So that's within the scope of practice of the LPN. She needs to help out on how to prevent the patient from falling. So B is included, right? Letter D, administering Haldol or haloperidol, definitely. That is a psychotropic medication. It's not IV, okay? That one is, it just says haloperidol, Haldol only, okay? So it didn't say IV, so then definitely we can include that. But if it said IV in the situation like letter D, IV, then the LPN cannot give IV medications. All right. Letter A should be for the RN. Assessment for the presence of new onset delirium. That would be for the RN, definitely, everyone, because especially with the word new onset delirium. And we have to go back to what we said the last time, that LPNs can assess. However, they can only do specific assessments like auscultation of bowel sounds, checking the heart rate, or assessing the color of the stool. Okay. Now, A is a complex assessment, new onset delirium. Now, letter C, explaining the purpose of medication used to the family. Definitely, that would be for the RN, especially if you're talking of a chemical restraint. Haldol or haloperidol is a chemical restraint. So we need to explain the risks and the benefits to the family. That would be teachings. That would be letter C. That would be for the RN, everyone. Okay? And then letter E, completing the full prevention care plan. That would be the responsibility of the RN. Okay? Now, one thing to remember, everyone, in the NCLEX, it would be almost very uncommon to answer restrain as the answer in the question, because restrain, usually we avoid that to our patients. The most important thing is before we apply restraints, or before we give chemical restraints or physical restraints, we have to figure out least restrictive means first, or alternative interventions. Okay, what is the cause of the patient's behavior? Maybe he is having pain, maybe he misses his family, or maybe he is bored. So we need to figure out first what to do before we actually apply restraints. Okay, so maybe the patient needs to join group activities, for example, or maybe we need to have the family visit the patient, or maybe we have to treat the cause, which is the pain of your patient. Okay, so in the NCLEX, we want nurses who doesn't restrain patients. So as much as possible, before you pick that answer of restraint, did you do everything first? Okay, because restraining is the last resort. Okay, and you need a doctor's order for that. And you also have to remember that restraining the patient or the client may also have dangerous outcomes, right? It can lead to injury, it can lead sometimes to asphyxiation or suffocation. And there are some patients that when you apply restraints, the more that they become restless and agitated. All right. So hopefully you learned something out of that explanation, everyone. Okay. So always they said, okay, do not delegate your eat. Of course, we mentioned that in this class many times, right? So thank you very much. Okay. So, all right. So let's proceed now to another one. I would just like to present again our program, everyone. I would just like to announce that we do have the self-study programs for online NCLEX review, and it comes with a workbook. And the workbook is something that a lot of our students like. And then also we have the live webinar every Saturday, and we will actually start this October 10. That's 8 to 4 p.m. October 10 live webinar class, and that's going to be for 10 days. Okay. And then also every Tuesday, we are having a fast track NCLEX review from 6 to 9:30 p.m. So we do live webinars also. So please check our website, everybody. Okay. And also another exciting news for everybody. Okay. We have a big demand for the 50% off. A lot of students were emailing me to extend the 50% off. So because of the big demand, everyone, we're extending the 50% off in the next 24 hours, everyone. And we don't know anymore again when is the next time that we will have your 50% off in this program. Okay. So 50% off for the 1 year online access. So instead of 449, we're giving that only for 224.50, and it comes also with the ebook and the access to all the courses. Okay. So after 7:40 p.m. tomorrow or 8 p.m. tomorrow, then this promo is not going to be there anymore. Okay. All right. So we will be announcing also the winner for tonight's, okay, or last week's raffle. We'll be announcing that. So we have Menchi has a comment. Thank you, sir, for over 4 getting what you're teaching for prioritization delegation. Thank you. Yes. Okay. So yes, we did have students already pass the NCLEX, guys. Okay. And also we have Claire. Claire is our winner the last time. So Claire, how are you finding our online academy? So you're there right now, 90-day online review, and you're a visual learner. So you like all of the drawings and all of the explanations. Very good. You're a visual learner. Very good. Okay. So our winner for tonight, everyone, is going to be Kenny Tetang. Okay, so Kenny, you're the winner. So Kenny attended last week. So he's the one who won our 90-day free online NCLEX review. Can you please give a shout out and say congratulations to Kenny for winning our 90-day online access? Okay, and watch out every time I post in Facebook. Watch out, everyone, if we have a 90-day. It seems like at this time we cannot give the free NCLEX review every week, but just watch out. Maybe next week there's another one again. So watch out, everyone, in my announcement, because it really helps a lot of students when they try our program and they pass their NCLEX examination. And this is our way of helping our students right now because of the whole coronavirus situation. So we are giving free access to our online platform, everyone. Thank you very much, everybody, for being here tonight. And I'm so excited to always have this session with you every Thursday. It's a lot of work, but I hope that I'm making a difference and that really all of you are learning from this. Okay. I also encourage you to use other resources so that at least there's repetition of information. And of course, the goal of our program is to make everything simple, fast, and easy. So thank you very much, everyone, and have a nice night, everyone. Thank you.